Welcome to our Doctor Channel, your destination for reliable medical information, breakthrough research, and insightful discussions on all things health-related.
Frozen shoulder, also known as adhesive capsulitis, is a condition that affects the shoulder joint, causing pain, stiffness, and limited range of motion. It typically develops gradually over time and can be quite painful and debilitating. Here, I'll describe the symptoms and causes of frozen shoulder in detail. Symptoms of frozen shoulder. Pain. Persistent shoulder pain is one of the hallmark symptoms of frozen shoulder. The pain is often dull or aching and may worsen at night, making it difficult to sleep on the affected side. Stiffness. Stiffness in the shoulder joint is a prominent feature of frozen shoulder. As the condition progresses, the stiffness can become severe, limiting the range of motion in the affected shoulder. Limited range of motion. Range of motion is significantly restricted in the shoulder joint. Initially, there may be difficulty in reaching overhead, behind the back, or across the body. As the condition worsens, even simple tasks like combing hair or putting on a coat can become challenging. Painful movements. Attempting to move the shoulder through its full range of motion can be extremely painful, especially during activities that involve lifting, reaching, or rotating the arm. Progression through stages. Frozen shoulder typically progresses through 3 stages. A. Freezing stage. This is the initial stage, characterized by increasing pain and stiffness. It can last from a few weeks to several months. B. Frozen stage. During this stage, the pain may begin to diminish, but the stiffness in the shoulder becomes more pronounced. Range of motion is significantly limited. This stage can last for several months. C. Thawing stage. In the final stage, the range of motion gradually improves, and the shoulder begins to thaw out. This process can take several months to years. Causes of frozen shoulder. The exact cause of frozen shoulder is not always clear, but several factors and conditions can contribute to its development. Inflammation and scarring. One leading theory is that frozen shoulder begins with inflammation and the formation of adhesions, scar tissue, within the shoulder joint's capsule. This inflammation and scarring can lead to the characteristic stiffness and pain. Underlying medical conditions. Frozen shoulder is more common in individuals with certain underlying medical conditions, such as diabetes, which may affect the body's ability to heal and repair tissues. Other conditions, like thyroid disorders or heart disease, can also increase the risk. Immobilization. Prolonged immobility or reduced use of the shoulder joint, such as after surgery, injury, or an arm in a sling, can increase the risk of developing frozen shoulder. Hormonal changes. Some hormonal changes, like those occurring in menopause, may be associated with a higher risk of developing frozen shoulder. Age and gender. The condition is more common in people between the ages of 40 and 60 and is more frequently diagnosed in women than in men. Genetics. There may be a genetic predisposition to developing frozen shoulder, as it can sometimes run in families. Autoimmune diseases. In some cases, autoimmune diseases like lupus can be associated with an increased risk of developing frozen shoulder. It's important to note that the exact cause and risk factors can vary from person to person, and not all individuals with risk factors will develop frozen shoulder. Early diagnosis and treatment by a healthcare professional, often involving physical therapy, pain management, and occasionally corticosteroid injections, can help manage the symptoms and improve shoulder function. In some cases, more aggressive treatments like manipulation under anesthesia or surgical release of the joint capsule may be necessary to regain full range of motion in the shoulder.